Video presentation by Department of Panchakarma, Sri Sindhi Shantavireshwar Ayurvedic Medical College and Hospital, Haveri. This video is about applied Panchakarma in cystitis. Contents of cystitis: introduction, etiology, risk factors, symptoms, diagnosis, differential diagnosis, treatment, reference, conclusion. Introduction to cystitis. Cystitis is an inflammation of bladder, usually mild and can heal spontaneously. Cystitis is a urinary tract infection, can involve men and women of all ages. According to National Kidney Foundation, 10 to 20% of women had at least one episode of cystitis, and 80% of this group will suffer from recurrent infections. Etiology: infection cystitis, commonly caused by gram-negative bacteria, especially E. coli. Other bacteria are enterococci, enterobacter, etc. Non-infectious cystitis, interstitial cystitis, cause of chronic inflammation of bladder called as painful bladder syndrome. Drug-induced cystitis, certain medications, especially chemotherapy drugs such as cyclophosphamide, can cause drug-induced cystitis. Radiation cystitis, giving radiation in pelvic area, can also cause cystitis. Risk factors: women, sex activity, contraceptive use, menopause, pregnancy, and pattern of micturition. Symptoms: pain during urination and burning when you urinate, needing to urinate often and urgently, passing only small amount of urine that is dark, cloudy, or strong smell, urine that contains traces of blood, that is hematuria, pain above pubic bone or in lower back, feeling unwell, weak. Diagnosis: medical history and physical examination, urine analysis, urine culture, imaging tests like ultrasound and CT scan, cystoscopy. Treatment: general management, increased fluid intake, hygienic measures, pharmacological treatment, antibiotics based on culture sensitivity test. In uncomplicated cystitis, nitrofurantoin 100 mg BID dose for 5 days, phosphomycin single 3 gram dose. In complicated cystitis, medications are given for longer duration for 7 to 14 days. Medications such as ciprofloxacin, levofloxacin, etc. Urine alkalizers, potassium citrates help in relieving burning. Analgesics for short-term use. Follow-up: re-evaluation in 3 to 5 days if there is no improvement. Repeat the culture if symptoms persist. Goals of physiotherapy in cystitis: relieve pelvic floor muscle tension, reduce bladder pain and urgency, improve bladder capacity and control, correct postural imbalance, enhance quality of life. Physiotherapy techniques used: pelvic floor muscle rehabilitation, myofascial release, gentle internal or external manipulation to release trigger points, pelvic floor muscle stretching for hypotonic pelvic muscles, biofeedback therapy to reach relaxation of pelvic floor muscles, Kegel exercises, bladder training, gradual increase in voiding intervals, and encouraging patient to delay urination to increase bladder capacity. Adopted Panchakarma in cystitis. Snehana, Abhyantara Snehapana with Mahatiktakagruta, Trifalagruta, Gokshuragruta, Abhyanga with Balashwagandhadi Taila, Chandanadi Taila. Svedana, mild fermentation over lower abdomen and pelvis with Nadi Sweda or Bashpa Sweda. Svedana relieves pelvic stiffness and promotes dosha movement. Virechana, best Panchakarma for Pitta dosha in Pittaja Mutrakruchra. Helps eliminate excess heat, toxins from liver and intestines. Drugs used are Trivru Churna, Eranda Taila, and Avipattikara Churna. Basti, most effective and specific therapy for urinary disorders involving Vata. Niruha Basti with Dashamula Kashaya, Punarnavadi Kashaya, or Varanadi Kashaya. Clears urinary tract inflammation. Anuvasana Basti with Balataila, Gokshurataila. It nourishes bladder and relieves Vata imbalance. Uttar Basti is highly beneficial in treatment of Mutrakruchra and Mutragata. Useful in chronic and recurrent cystitis. Dravyas used are sterile Gokshura Taila, Bala Taila, Estimudu Taila. Reference: Charaka Samhita Chikitsa Sthana, Chapter 26, Sushuta Samhita Uttaratantra, Chapter 58, Ashtanga Uttaratantra, Chapter 39. Conclusion: in Ayurveda, Cystitis is more closely correlated with Mutakuchra, a condition characterized by painful and difficult urination, often due to vitiation of Pitta and Vata doshas. The condition is primarily caused by Agni Dushti, ama accumulation, and improper lifestyle or dietary habits, leading to urinary tract inflammation. Ayurvedic management focus on Shamana Chikitsa using herbs like Gokshara, Punarnava, Varuna, and Yashtimadu, and Shodhana Chikitsa through Panchakarma, especially Virechana, Basti, and Uttar Basti in chronic cases.